keloid. So what is keloid? Keloid is a non-cancerous fibrous proliferations that occur in the dermis after trauma or injury to the skin. So it is non-cancerous fibrous proliferation that occur on the dermis after the trauma or injury to the skin. So here the important point is keloids grow beyond the boundaries of original wound site, and the etiological factors that determine how a scar becomes a keloid remain unknown. So keloids that grow beyond the boundaries of original site. Etiological factors that determine how a scar becomes a keloid remain unknown. Individuals with dark pigmented skin or who freckle are more predisposed. So seen largely in Africans, African American and Asians. So keloid is a multifactorial presentation. So it can be a familial or genetic predisposition, and it can be due to immunological causes and result of an overactive inflammatory response and fibroblast proliferation, and it is due to the result of an abnormal collagen deposition in the healing skin wound. These are the etiological factors for formation of keloid. So the skin wound tension, it is also a contributing factor in keloid formation. Individuals with an inflammatory or infections element are at a predisposition for keloids. So if after any surgery or injury to the skin, that is if there is presence of wound tension, it is act as a contributing factor formation of keloid. What are the numerous theories for etiology of keloid? The first one is allergic IgE, that is immunoglobulin E mediated response, and the second one is deficiency in melanocyte stimulating hormone, that is MSH metabolism, and or an excess of MSH, and the third one is microvascular occlusion and subsequent hypoxia. So if there is any allergic IgE mediated response and MSH deficiency or excess, and the important gene that present in the keloid are interleukin 6 expression in the pathophysiology of keloids, and insulin like growth factor 1 and insulin like growth factor 1 receptor axis in the invasive activity of keloids. So these are the theories we have to remember in formation of keloid. This picture showing the keloid that present on the ear lobes, showing there is a non-cancerous proliferation that extend beyond the boundary of original site. And what are the symptoms? Patient morbidity related to keloids includes pruritus, pain, tenderness, burning, secondary infection, ulceration and restriction of motion. So patients prone to keloids are prophylactically treated with radiation post-surgery to avoid any future keloid. So if we treated a keloid surgically, we have to give radiation after surgery to prevent future keloid formation. The mostly keloid patients don't have any pain or itching or irritation, but definitely there is a cosmetic appearance is the most disturbing one. So numerous treatment protocols have been developed over the years with none showing universally accepted superiority. So the most important symptom is cosmetic appearance. And what is hypertrophic scar? It is similar like keloid, but there is a difference. What is the difference? Hypertrophic scar is a widened or unsightly scar that does not extend beyond the original boundaries of the wound, and it reaches a certain size and subsequently stabilizes or regresses. Next, the treatment for keloid. What are the treatment of keloid? So keloids are often resistant to treatment and have a high recurrence rate. It's very important. Keloid have a high recurrence rate. So there is a multiple treatment modalities have been advocated for keloids. So what are the treatment options? First one is surgical and non-surgical, and the third one is combined modality. Let's see about individual treatment options. The first one is surgical. So it is a simple surgical procedure with no tension, no tissue tension. If there is tissue tension, it produces again a keloid. And the second option is non-surgical, pressure garments or injection of intralesional triamcinolone, lasers such as CO2, that is carbon dioxide, and pulse dye, and Nd-YAG laser and argon laser. And Nd-YAG, neodymium, yttrium, aluminium laser. And in non-surgical, there is various therapies including nitrogen mustard, tetraquinone. So antihistamines, retinoic acid, zinc, vitamin A, vitamin E, and verapamil, and interferons. These are the treatment options in non-surgical method. And the third one is combined modality. Here the laser assisted skin healing after excess hypertrophic scar tissue was removed. The author applied laser irradiation followed with topical silicone gel sheeting for 2 months, and 6 months after revision if there is no recurrence. This is a combined modality. So we have to laser assisted skin healing, then go for a radiation. So, and the other one is cold knife excision followed by post-operative injection of intralesional steroid. These are the treatment options for keloid.